Hello, everyone, and good afternoon. My name is Salima Thomas. I serve as the Deputy Chief of Staff and District Director for Congresswoman Valerie Foushee. Thank you all for joining us for today's Medicaid and Medicare virtual panel. Today marks the 60th anniversary of the signing of the Medicaid and Medicare Act by President Lyndon B. Johnson on July 30th, 1965. These landmark programs have significantly impacted access to health care for millions of Americans, providing coverage for seniors, individuals with disabilities, and low-income families. Medicare provides health insurance for individuals aged 65 and older, as well as those with certain disabilities. Medicaid, on the other hand, offers health care coverage to low-income individuals and families, including children. Both of these programs have evolved significantly over the years, and expanding eligibility and benefits have been a significant cornerstone in the recent years. However, there are significant changes that will impact Medicare and Medicaid, particularly in North Carolina, um, as a result of the recent One Big Beautiful Bill. And today we have experts from our district. First, we have Laquana Palmer, who is the Deputy Director of North Carolina Medicaid Communications and Engagement. Also, Dr. Robert Saunders, who is a health policy expert and researcher, along with Vanessa Watson, who is the State Director of Protect Our Care, North Carolina. All of these experts today will provide insights as to how this new legislation is going to impact these programs, particularly in our communities. Today's format for today's webinar will be you'll hear from our three speakers, followed by an opportunity for Q&A. You have the opportunity to also submit questions as a part of your registration, but we will have an opportunity throughout the course of today's webinar to submit questions via the chat, and we will answer them during the question and answer portion. So before we get started, I would like to turn it over to Congresswoman Foushee to provide some pre-recorded remarks on behalf of our office today.
Hello, I am Congresswoman Valerie Foushee, the federal representative for North Carolina's 4th Congressional District, and I am pleased to welcome you to my virtual Medicaid and Medicare Lunch and Learn panel session. Thank you to our special guests and presenters this afternoon, Laquana Palmer, Dr. Robert Saunders, and Vanessa Watson, for taking the time to share critical information about the effects that the GOP's Big Ugly Bill will have on Medicare and Medicaid. These are hard-fought benefits that all recipients deserve, and I want you to know that I will keep fighting to ensure everyone has access to affordable care. Health care is a human right, and this bill is a shocking step backward from caring for and supporting the most vulnerable individuals in our communities. In North Carolina alone, an estimated 600,000 people will lose access to health care between now and 2034 because of this harmful legislation. With so many lives at risk, it's more important than ever to fully understand what is changing, how to prepare, and what support is available to you. And that is what today's session is all about, to provide you with the information and tools you need to navigate the upcoming changes to Medicare and Medicaid, and to learn how best prepare yourself and your family at this time. As your partner in Washington, I will continue working to protect your health care and to reverse the effects of this deeply damaging legislation, and I will continue to host events like this one, which help inform you and connect you to the support you may need. Thank you all again for joining us, and thank you to our special guests for taking the time to participate in today's session. If you have any more questions or need further assistance with any federal agencies, please do not hesitate to contact my office at 919-967-7924 or reach out through my website at foushee.house.gov. My team and I are here to serve you.
Thank you, Congresswoman, for those remarks. With that, we will turn it over to Ms. Palmer to start off today's session and share information from the North Carolina Medicaid office.
Thank you, Director Thomas. I appreciate the opportunity to speak with you all today on the changes that are happening to not only just Medicaid, but I'll also touch on some of the changes that are going to be happening with SNAP as well. I know that today is the 60th anniversary that we celebrate Medicaid and Medicare and the work that has been done to help with ensuring that not only that our aging community, but also with those that are disabled and those that have other economic needs have an opportunity to access health, but it also gives an opportunity to be able to share more time with family. I want to make sure that I have time to go through slides, so we'll go ahead and hop right on in. If we go to the next slide, some of the things that we'll discuss today are the impacts of federal Medicaid changes for the counties. What are some of the impacts of federal changes on SNAP, and what are those changes that are coming to those counties as well? And then a timeline for key decisions that will happen with our North Carolina General Assembly and some of the decisions that will impact, again, many of the residents here in North Carolina. And then we'll save some of that Q&A for the end to ensure to get an opportunity to answer some of the questions that I already see that are coming in. So if we go to the next slide, what are some of the impacts on Medicaid? We've heard of HR 1, the one big beautiful bill. I also heard Congresswoman Foushee refer to it as the one big ugly bill. And so with that in mind, here are some of the changes that will happen to Medicaid specifically. If you go to the next slide, there are some key decisions for our General Assembly as a result of the impacts that are coming down from that HR, what I'll refer to as HR 1. Some of the things to keep in mind is that one, they're going to add work requirements that limit provider taxes and threaten to end Medicaid expansion unless the General Assembly acts. When we think about work requirements, we think about that there possibly be administrative costs. It is also a way for them to increase costs for Medicaid expansion as well, and also increase hospital provider taxes. And with that in mind, if that does happen, we have a number of things that will happen. One is that it will enact technical correction to the hospital provider tax formula. And so if you think about a formula in place, and I won't go into detail because again, there's some other things that we want to make sure that we highlight. Think about things that would be put in place that cause a trigger in North Carolina that will end our expansion work. There's a trigger law here in North Carolina that we have in place. And if we have anything that happens to our provider taxes that decreases the amount of money that is coming into North Carolina to cover Medicaid, that trigger law goes in place. And if that trigger law goes in place, again, we will lose expansion. Not only do we lose expansion, we won't even have an opportunity to implement the work that it takes for to bring in work requirements. We also have other financial mechanisms in place, but again, ultimately, the risk that we want to highlight today is losing expansion. If you go to the next slide, we also want to highlight who is covered by Medicaid right now. In North Carolina, we cover 3.1 million North Carolinians. And this morning, I was able to pull up what does that mean for the fourth district. In Chatham County, we have 12,981 beneficiaries or members that are part of Medicaid. In Durham County, we have 76,482,000 beneficiaries and members. Orange County, 21,495 individuals. And then in Wake County, which is the second largest county in North Carolina, but also has the second highest number of members on Medicaid, that is 219,777 individuals in North Carolina that could be impacted. So as we're thinking about just the work that is happening with the trigger law that is in North Carolina and the federal changes that are coming along with the different changes, these are the folks that we are keeping in mind that will be impacted. If you go to the next slide, again, just thinking about those the reconciliation bill and the changes to Medicaid. Again, with those costs and cost sharing that come to North Carolina, we're looking at provider taxes being changed. We're looking at impacts to our long-term care facilities, and we're also thinking about our healthcare providers. This is the network of individuals who are serving those that are accessing care. And again, if you think about what does the dollar amount mean, that is $22.5 billion that will be taken out of the North Carolina economy over 10 years. So, although we may not see impacts right away, we will begin to see impacts within the next year, next 2 years. If you go to the next slide, which we look thinking about the work requirements. If we see right now with those who are benefiting from expansion, and if you think about expansion, expansion now reaches individuals in between the ages of 19 and 64. Those individuals would now be required to report in 80 hours a month, and that report has to be paid work, it has to be job training, community service, or in school. So again, that's 80 hours a month that they have to report to Medicaid to ensure that they are able to maintain their eligibility. That will impact 255,000 North Carolinians that could possibly lose coverage if they're unable to report in those different reports. If we go to the next slide, again, looking at federal changes, and I'm going to try to move more quickly because I want to make sure that we cover our SNAP benefits as well. Again, we're seeing changes to our state directed payments. Again, this is $6 million in enhanced payments that we won't have here in North Carolina. Again, these are things that are impacting our healthcare system that will prevent stabilization and to prevent healthcare access across North Carolina. If you are going to the next slide, we are looking at, again, eligibility, especially looking at determinations. If we're looking at determinations, if we have in place every 6 months, an individual has to check in to see whether or not they qualify for Medicaid. That causes a huge burden on a number of folks here in North Carolina. That causes the burden because if you think about folks who are working, we're thinking about folks who are in school, we're thinking about folks who are doing community service. They have to take off time from work to be able to go and check in every 6 months on whether or not they still have that eligibility. That's a lot on a number of our different families. Overall, if we think about Medicaid and the federal changes that are coming to North Carolina, we're looking at 49.9 billion, that is billion with a B, dollars that can impact us over 10 years. So if you break that down, we're seeing more than 70% of Medicaid costs that will come to North Carolina. Those are cuts to our hospital expenditures. Again, those long-term facilities, that is our nursing homes, those are our different facilities that are caring for our loved ones. If we think about our rural hospitals alone, we will see a cut of $3.7 billion. Up to half of that could be in our rural healthcare provider fund. Even though we're hoping that that be temporary, that is a major cut that it could come to North Carolina. We're also looking at hundreds of thousands of North Carolinians that could expect to lose their healthcare coverage. Medicaid is coverage that we use to help with making sure that we can get preventative care. It is to ensure that people have access to their eye care. It is to ensure that individuals have access, again, to healthcare facilities. A number of different healthcare needs that are out there, folks will lose access to that. With the new statutory changes, there is an increased cost for these administrative costs to be able to do the every 6 months checks at the county level. It is an increase in administrative costs to ensure that folks are checking for those work requirements every 6 months. But not only that, I want to highlight again, it would likely trigger the trigger law here in North Carolina that would end Medicaid expansion. It took us 10 years to get to expansion. And with all of the work that went into a number of you all who are on the call today, but not only just the work that went in, it is a loss in coverage for 671,000 individuals here in North Carolina. That is a major cut to the folks that we highlighted in the different counties that are covered in this fourth district. If we go to the next slide, we want to highlight some of the changes in SNAP. So SNAP, that is what a lot of our individuals in our communities refer to as food stamps. And so when going to the grocery store and going to different markets that allow us to pick up food for our families, many of our families are going to be impacted if we see these cuts. If you go to the next slide, There's some key decisions that have to happen here in North Carolina because of the new laws that have come down from that one big beautiful bill. We're going to see a shift in the benefit costs come to the state programs. And so that means that the state will now be responsible for $420 million a year. Right now, the state can't pay that. The state just does not have the dollars allocated right now to be able to do that. And so there'll have to be different shifts or a complete elimination of SNAP in order for us to be able to foot the bill. So again, in 27, 28, we look at approximately $420 million in the state budget that we will have to take care of. But not only that, there's a couple of things that we have to keep in mind with the two decisions that will be made. One, we have to withdraw from the SNAP program completely, or two, we have to shift those costs now to our county partners, which could absolutely cause barriers and how we're able to get food to a number of our different families. If you go to the next slide, again, 1.4 million North Carolinians rely on SNAP. So we have our children and families. We have over 600,000 children under 18, and also over 159,000 older adults who benefit from SNAP. That's 4 in 5 families that are participating in SNAP right now. And that's 66% that are participating that have children, and more than 34% of seniors are adults with disabilities. Again, these are major, major impacts on the state of North Carolina. Keep in mind also, 46,000 North Carolina veterans are also receiving the SNAP benefits as well. If you go to the next slide, we'll see that also, again, with the reconciliation bill, we're seeing payments. Yes, there may have been some overpayments. Yes, there may have been some places underpayments. And with that in mind, that is why some of these things are going in place. They're trying to help with correcting some of the errors that were saw in a number of different states. But ultimately, again, if they're seeing cuts to SNAP, if we cut SNAP completely, we're going to see major changes, major issues with food security here in North Carolina. If you go to the next slide, again, the administrative costs are very, very costly. And if we have to take that on, that is something that will go down to the county level. Many of our counties will not be able to take on some of those costs. Again, if you look at $16 million in administrative costs, $67 million at the county level, that's a lot of money in North Carolina that we'll have to come up with. Go to the next slide. And again, we're looking at those 18 to 64 doing work requirements. Over 90,000 adults will be impacted by this. And so, again, there's just so many requirements that are coming down, not only just for Medicaid, but for SNAP as well. And we just know that many families, they may not be able to handle that. Let's go to the next slide. So there's two things to keep in mind with SNAP. One, either the state will increase the costs and they'll take on the costs for taking on SNAP, or they will have to eliminate SNAP completely. Those are the two options that we have here in North Carolina. If you go to the next slide, again, we'll take on the share of taking on those benefits. Again, it's just a breakdown, and hopefully we'll be able to share these slides going forward so that you all can know what that breakdown is. But again, that is $420 million here in North Carolina that we'll have to take on and send to the county level to be able to take on. So that is Chatham, Durham, Orange, Wake. If you think about your DSS agencies, those are the agencies that are going to be impacted by these changes that are happening, both with SNAP and with Medicaid. If you go to the next slide, here are some of the key decision points that we are working with our General Assembly right now. And as you can see, as of right now, we're going to be taking on the work requirements for SNAP. Those changes will take place almost immediately. That is something that we're working on right now. If you see for the number of months and look at the General Assembly right now, we're going to do some budget planning, and that budget planning will involve us making budget decisions as to how we're going to be able to incorporate things such as the work requirements every 6 months, but then also what happens with Medicaid expansion. So there's a number of decisions that are being made on this timeline. We're also looking at our SNAP benefits. The SNAP benefits cost share won't happen until 27, 28. But again, we're going to gradually think about how those provider taxes may begin and help with that situation. So again, we will share the slides. We will make sure that this goes to everyone. If you do have questions for me, I can be reached at medicaid.ncengagement@dhhs.nc.gov. Hopefully, I was able to share a number of those changes and impacts here in North Carolina, and hopefully, we will be able to work together to help with mitigating those changes, and hopefully, they won't impact our different families. And now I'll turn it back over to I think we have Dr. Sanders that is on.
Dr. Saunders, before you get started, just wanted to share something really quickly to all participants. We will be sharing the slides as well as a recording. So thank you so much, and please continue to share any questions that you might have for our panelists in the chat. Dr. Saunders, it's your turn. Thank you.
Thanks, Director Thomas, and thanks, Laquana, for that presentation. I'm Rob Saunders. I off the bat, I should note that I do not represent Duke University or Duke University Health System, and I'm speaking as an individual. And my job here for the next 10, 15 minutes is to give an overview of what was in what's been called either the One Big Beautiful Bill Act, HR 1, reconciliation legislation. There's a number of names. And there's a number of nuances and details in such a large piece of legislation, and be able to unpack that a bit, and then note where that applies and how that will impact folks in North Carolina. And I'll talk a bit about Medicaid, I'll talk about Medicare, and I also may flag there are some impacts here on folks who get insurance or coverage through the Affordable Care Act exchanges as well. And so want to highlight that as well, that there's another health policy impact here. I think I also am keeping track of the questions that are in the Q&A, so I'll try to hit some of those as we go through. So talking about Medicaid, let's do that first. Medicaid financing is very complex and is funded by federal and North Carolina and state sources. In the way that North Carolina funds Medicaid, its Medicaid expansion was partially funded through taxes on healthcare providers. So what's called provider taxes, as Laquana mentioned, to one of the questions that got asked here. And the theory of that is that because Medicaid coverage is supporting healthcare providers were willing to provide impact and funding to support its expansion. So one of the things that happened in the OBBBA or HR 1 or the reconciliation bill is there are now limits on how much states are allowed to use those so-called provider taxes or to raise funds from taxes to healthcare organizations. And as Laquana mentioned, that has impacts then in North Carolina. As that rate or that amount of taxes that are raised decreases, the state will have to make some decisions, and those decisions may be pulling back on Medicaid expansion entirely. And North Carolina does have a trigger law that says if there are major changes to financing for Medicaid, that it has the ability to go back. It may mean cutting other programs in order to fund Medicaid, may mean finding taxes in other places. But those are all decisions that probably the General Assembly is going to have to make as it's thinking about where that funding comes from and how they can afford Medicaid expansion given these changes that are happening. One of the other questions we've gotten in the Q&A goes to work requirements. So one of the challenges as we talk about work requirements is there's a lot that's unknown. So the legislation set forward big parameters for work requirements, saying that in general, that folks need to show that they are spending 80 hours per month on some type of work or community service or education. But the details will have to be implemented by the states, and each state will have to set that up differently, and that's going to take some time. States will have to change their IT systems, they'll have to change their processes. The challenge is that this is all going to be implemented very quickly. So the federal Health and Human Services will be putting out some guidance by the end of the year, and then states are going to need to start doing some outreach later 2026 and really start implementing everything by into 2026, very early 2027. And so there's a lot of details here that we don't know the answer to at this moment because the state of North Carolina and states across the country are figuring out what the work requirements might look like. One of the challenges here is, and these work requirements, to one of the questions, are only, we're talking about Medicaid. And we're actually specifically talking about people who were recently enrolled in Medicaid because North Carolina expanded Medicaid. For a little bit of background, when Medicaid was created 60 years ago, it was created for very specific groups of people. And when Medicaid was expanded as part of the Affordable Care Act, it expanded to all people up to a certain income level. And so people who are not part of those specific categories that were defined 60 years ago are the people we're talking about right now in terms of these work requirements. The challenge in the work requirements is about administration. So surveys and studies in the past have shown that most Medicaid beneficiaries already are participating in some type of work or education or the like if they can. Some folks, for instance, are caring for a sick family member or caring for children, and so they may not have the ability to have work outside the home during that case. But one of the challenges in work requirements has often been in that administration. So folks who may meet all those requirements, but don't aren't able to fulfill all of the administrative requirements may lose their Medicaid coverage. And so that is one of the challenges here. And that's one of the issues that the state of North Carolina is going to have to think a lot about, is how those processes are put in place to try to minimize folks losing coverage simply because they may not be meeting some of the administrative requirements. There's other administrative requirements that were in the legislation. Kwana mentioned, for instance, folks will have to show their eligibility every 6 months instead of every year. There's also one of the questions asked about co-payments. So normally Medicaid has very limited cost sharing or co-payments when you go to visit a doctor or a hospital or the like. There's going to be new cost sharing for people who have that Medicaid expansion, especially those who have incomes above 100% of the federal poverty level. So there'll be new cost sharing of $35 per service for people who have Medicaid under that expansion option. To the question, prescription drug cost sharing looks like that will not be affected in the current time frame, but other cost sharing will be. And another big question here is impacts on our healthcare facilities. So one of the challenges that you may hear as you talk to different healthcare facilities around the state is that especially in rural areas, there are challenges in remaining financially viable. That it's been a challenging time in healthcare over the last 5 years. States have had some tools for targeting Medicaid funding to different types of healthcare facilities and for different types of services. Luquana mentioned that they're called state-directed payments, but in general, it's a way to target Medicaid funding to healthcare facilities that may need certain types of supports, or maybe for certain types of services like primary care, where we want to make sure there is robust amount of providers in that area. The One Big Beautiful Bill Act froze a lot of that state's ability to do that. There is this rural health fund or rural health transformation program that will be started in the short term. The details are still to be determined. It's going to be $50 billion starting next year and be determined through applications and also at the discretion of the Centers for Medicare and Medicaid Services. So the combination of all of this is a bit unclear in the short term for how that's helping our rural healthcare facilities. And that doesn't necessarily affect healthcare facilities in, say, more urban areas of the state, like the Triangle. So we've got some pieces here in terms of administrative requirements in Medicaid, work requirements in Medicaid, some changes in the amount of costs that folks might have to pay in Medicaid, and also some questions here in supporting our healthcare facilities. Talk about Medicare here for a second. Medicare was not specifically mentioned in the bill as much as Medicaid, but there are some changes. One, some of these are administrative requirements for specific groups. So for instance, there are some changes in enrollment for low-income Medicare beneficiaries into certain types of programs. One of the bigger issues here is that this legislation is scored by the CBO to increase deficits, and there are laws on the books and by the US government that if deficits are increasing at a certain rate, certain types of other actions happen to try to reduce deficits. And one of those is reducing Medicare payments. So the Congressional Budget Office estimated that the likely impact of the legislation is that we would see probably decreases of about 4% of Medicare spending from around 2027 to 2034, or that's about 490, $500 billion over that time frame will be reduced from the Medicare program. It's unclear how that will translate to folks who are on Medicare in the past. Sometimes that means that every clinician who serves Medicare patients gets a reduction of, say, 4% of their Medicare payments. And the concern may be that clinicians choose not to participate in the Medicare program anymore, which means that there'll be less access for folks who have Medicare. And so those are some of the challenges here. And then finally, the Affordable Care Act. So as folks may know, in 2010, there was expansions of insurance coverage through these insurance exchanges, healthcare.gov, for instance, where you can purchase private insurance but get subsidies that are paid for through the federal government. One of the challenges right now with that system is that there have been increased subsidies for the last several years to make insurance more affordable for purchasing it through the Affordable Care Act and insurance exchanges. Those insurance subsidies are likely going away at the end of the year, and that was not included in this legislation. So you may be seeing that individual insurance companies are advertising that they're going to raise premiums for next year unless the Congress acts. So that's something that is not in this legislation, but is something that is going to affect those Affordable Care Act exchanges and the folks may be seeing on the ground. There are new administrative requirements that the legislation didn't include for folks who get their insurance through the Affordable Care Act insurance exchanges. So you're not able to auto renew as easily. There's some new paperwork that you need to fill out every year and some new requirements that you have to fill out in order to get the federal subsidies for purchasing insurance. So let me stop there. And that was a quick whirlwind of provisions that were affecting Medicaid, Medicare, and the Affordable Care Act exchanges, and happy to answer questions when we get to that point.
Thank you so much for your time and for your insights, Dr. Saunders. And I also wanted to say thank you as well to Ms. Palmer for her insights as well. So without further ado, we're going to turn it over to Ms. Watson from Protect Our Care, North Carolina. And please continue to share any questions that you might have in the chat that any of our members could answer on today. Thank you.
Thank you. Good afternoon, everyone. I'm so grateful to be included on today's webinar to speak to you about the future of healthcare in our state and across the country. And I'm also grateful to have a representative like Congresswoman Foushee working for me and people like me in DC. We're facing a critical moment. Donald Trump and congressional Republicans have passed what they're calling the One Big Beautiful Bill, but behind that polished name lies the most devastating attack on healthcare in modern history. This bill rips over $1 trillion from Medicaid and the Affordable Care Act to pay for massive tax credits for billionaires and big corporations. Let me be clear, this is not just a budget issue. This is a human crisis, one that will harm patients, providers, and the economic health of our communities for decades to come. I'm going to start with hospitals, especially those in rural communities. This big, ugly bill slashes $13.4 billion in critical hospital funding for North Carolina alone. 6 hospitals in our state are already at serious risk of shutting down. That includes UNT Rockingham, Angel Medical Center, Granville Medical Center. If even one of these closes, the results could be catastrophic. When a rural hospital closes, the community doesn't just lose access to care. They lose an average of 220 jobs. Local businesses suffer, and emergency response times increase. People delay care or skip care entirely. Why is this happening? It's because Republicans gutted federal Medicaid funding that is a lifeline to keep these hospitals open. Medicaid expansion has shown to reduce rural hospital closures by 62%. This bill does the exact opposite. it guts the very funding that keeps these institutions afloat. We've finally expanded Medicaid here in North Carolina, and I do not want to go back. On top of that, the expiration of ACA tax credits at the end of this year will cost North Carolina 5,250 jobs, compounding the damage across the entire state. This isn't just a war on hospitals, it's a war on entire communities. When we talk about prescription drug costs, especially for those seniors and people with chronic conditions, this bill delivers a $5 billion giveaway to drug companies while raising costs for seniors and taxpayers. Instead of expanding access to affordable medications, the bill opens the floodgates for higher prices. A 45-year-old making $62,000 a year in North Carolina, for example, will see their health care coverage jump by $1,600 per year, and that's without accounting for higher drug prices. Additionally, without the ACA tax credits, more than 24 million Americans, including middle-class families, will see their premiums skyrocket. Some will be priced out entirely. Premiums could rise up to 90% or $700 per family on average. And if you're a small business owner or a freelancer, you'll be hit even harder, especially if your income fluctuates. Under this bill, families can be penalized at tax time for changes in income. That means unexpected bills of thousands of dollars. This is economic cruelty disguised as policy. The bill eliminates critical support that helped Americans afford prescriptions, preventative care, and routine doctor visits. Seniors who depend on Medicaid for long-term and pharmaceutical care may soon face impossible choices: buy their medication or pay rent, buy their medication or get groceries. No one should have to make that choice. I'm going to move on to mental health and substance abuse treatment, another area that this bill devastates. Right now, Medicaid is the largest payer of mental health services in this country. Nearly 1 in 5 adults struggle with mental illness access care through Medicaid. But under this bill, these services are on the chopping block. Veterans with PTSD, people suffering from addiction, bipolar disorder, and depression will find fewer providers, fewer beds, and fewer options, especially in these rural areas that we've been talking about. That means more ER visits, more avoidable death. Work reporting requirements only make this worse. People must now prove that they're working or volunteering to maintain coverage. But these requirements don't lead to higher employment. They lead to people losing health insurance. In Georgia, a similar program cost $26 million and only covered 3,500 people. That isn't about work, it's about cutting people off. Research shows that 5 million Americans will lose Medicaid coverage under these work rules, many of them battling mental illness or addiction, unable to navigate a maze of red tape. And let's be clear, these cuts hit people with disabilities especially hard. There's over 300,000 North Carolinians with disabilities who will rely on Medicaid. For many, it's the only way to get consistent life-saving care. This bill limits how the state funds Medicaid, caps key payments, and adds burdensome red tape that pushes people off coverage. This will undo 15 years of progress in mental health and substance abuse treatment. And let's not forget about long-term care and nursing homes. This ugly bill threatens the closure of over a quarter of nursing homes nationwide, including 13 right here in North Carolina. These aren't just facilities, these are homes, places where seniors are getting cared for with dignity. Medicaid covers 2/3 of nursing home residents. Without it, families will be forced to take their loved ones home, where they may not be able to have the ability or the training or the resources to provide the care that they need. And the result, it's burnout, it's financial strain, it's emotional trauma, and in many cases, it's unnecessary hospitalizations that further burden an already crumbling health system. What we're seeing here is an orchestrated dismantling of our healthcare system. Like I said, over 650,000 North Carolinians will lose Medicaid or ACA coverage. Over 1 million children in the state rely on the program, and that's at risk. Nearly 62% of adults Medicaid are working, but will lose coverage due to red tape. And Republicans have created a $2.5 billion hole in our state budget, threatening teacher pay, threatening public safety and infrastructure. All this to give tax breaks out to who? Billionaires and major corporations. This isn't just policy, it is a moral failure. So today marks the anniversary of Medicaid and Medicare, two essential programs that have transformed healthcare in the United States since its creation in 1965. I'm happy to celebrate the important milestone, recognizing that millions of lives this program has supported and provided access for the seniors, the people with disabilities, the low-income families. Their legacy reflects a commitment to health equity and compassion, and today is a reminder of the progress that we've made and the continued importance to protect and strengthen these programs in the future. So where do we go from here? We raise awareness, we organize, we fight back. Visit healthcare.gov or North Carolina's Medicaid and Medicare systems to enroll or get updated coverage information. You can explore Protect Our Care's website for detailed reports and advocacy opportunities. Call your legislators, demand that they protect Medicaid and the ACA, and reject work requirements and funding cuts, and share your stories. These personal testimonies, they're the most powerful tools we have to influence change. Like I said, this isn't just about politics. It's about people, our neighbors, our grandparents, our children. I'm not giving hope. I'm not backing down. We have the chance right now to stop the worst of this damage. We must act. We must speak out. We must organize because no one should lose their life, their home, or their future just so billionaires could get another tax break. If we don't act now, the consequences are irreversible. But if we stand together, we raise our voices, we demand better, we can protect and rebuild a system that serves everyone and not just the wealthy few. Thank you.
Thank you so much, Ms. Watson, for your insights and sharing information about the North Carolina impact across our district and our state. So at this time, I want to encourage you all to continue to submit your questions via chat. We have been answering some in real time as well as via chat, but I will read off some of the questions that have been submitted and want to encourage our panelists to feel free to answer if they have insights or updates related to that particular question. One of the questions that we received from Catherine, it says, what are provider taxes? Any one of our panelists have insight to share?
And I can start on that one and recognize Medicaid financing is incredibly complex. And I know we were throwing around a lot of specific terms there. But the basic idea there was that one of the ways that North Carolina funded its Medicaid expansion was through taxes on healthcare facilities or healthcare organizations. The reasoning behind that was that as more folks would have coverage, then the healthcare facilities would benefit from more reimbursement from, especially from places from care that they previously had done, out of pocket themselves because folks were uninsured, and so that was a mechanism that North Carolina used, and frankly, many states around the country used as they were supporting and funding their Medicaid programs. The way that the bill was structured is it reduced the amount that states are allowed to tax healthcare providers. It went from 6% to about 3.5% of memory serves, and there's a certain amount that decreases per year. And so the result of that is that there is less revenue coming into the state of North Carolina to fund its Medicaid expansion. And therefore, I think, as Laquana noted, that means that other sources of funding have to be used if we want to maintain Medicaid expansion.
Thank you. Anything else from our other panelists? Ms. Palmer?
No, Dr. Saunders hit it right on nail on the head. Absolutely. But I will add that with all of this in mind, even with the provider taxes and everything, we are still here in North Carolina still experiencing a budget shortfall. And we say a budget shortfall, that means that with the new requirements that have come down, the new administrative burden that we now have that has not only come to the state level, but it's now going to trickle down to our county levels, there is not enough money in place to ensure that we are able to implement a number of these different changes. And that is not just with Medicaid, that is with SNAP, that is with a number of different services in Health and Human Services. And with that in mind, I will not say that we are experiencing a cut, but the General Assembly is currently in progress as we speak, making decisions on our budget and how that will impact a number of different programs here in North Carolina. One that I'll highlight, and it is a program that did not get a chance to come to the fourth district. It is our Healthy Opportunities program. And because of the fact that we do not have funding that has been allocated for that program that allows us to be able to look at social drivers of health, such as being able to put food on the table. So, again, food insecurity, being able to have transportation, being able to look at housing as well. We are experiencing now a cut to that program, and we stopped that program. It was implemented in three other regions of the state, but the next phase was to implement that in this district. But with that funding being cut, we no longer have access to those programs. And we have some questions in the chat where it says, "Hey, what happens to my prescription drugs? What happens to different services that I'm getting right now?" Please recognize with these changes that are coming down from HR 1, we will experience the changes to our Medicaid program. Do we know what those changes are? We don't know what those are at this time, but those are changes that we are currently discussing at the state level, and we don't know if it's going to be prescriptions. We don't know if it's going to be access to long-term care. We just don't know. We won't know that until we get a budget from the state of North Carolina. And that is something that is not determined by DHHS, that is determined by our legislators in our General Assembly. But those are impacts that are being caused by HR 1 that are trickling down as to now administrative burdens that we have here in North Carolina.
Thank you, Ms. Palmer, for offering clarity on that. There was a question in regards to how should we continue to outreach to our legislators, and I think you outlined that really well. Another question that we have is from is in regards to how this bill is going to impact veterans, and can they get care at a VA hospital or clinic?
One of the things that I highlighted, I think in the presentation, was that 46,000 veterans currently receive SNAP benefits. And we're seeing that um, if those SNAP benefits are not in place, we will see issues with food insecurity amongst our veterans. I don't have the number in front of me as far as the number of veterans, but think about not only though we have Medicaid that helps a number of our veterans, but we also have their family members. And so we know that if the family isn't taken care of, the veterans who have been taught to practice, protect and serve our families, they will also be impacted as well. So again, I don't have that number in front of me, but just keep in mind, I said that in just Wake County alone, 219,777 individuals receive Medicaid benefits. And so with that in mind, if we have changes that come to our Medicaid program, that is the number of folks that are be impacted in North Carolina in Wake County alone. Everyone on that number? No, but a large percentage of folks under that will be impacted.
Thank you so much for sharing that. We have another question that was submitted. It says, prior to Medicaid expansion, some individuals had access to state funding for services, the IPRS. Will state-funded services be available for individuals in need of services who are dropped from Medicaid, or will these individuals be forced to lose all services?
What we currently still have in place is with the Affordable Care Act, still access to the marketplace. And so a number of those individuals, if they no longer have access to Medicaid, will now have to go to the marketplace in order to utilize access to new benefits. But as far as the program that was formerly in place, that is something that our state leadership is still making decisions on whether or not there will be new programs or programs that we had in the past that we will have to bring back to help with with a number of folks that may lose benefits as a result of not being able to either comply with this new eligibility requirement with work requirements, or be able to go in every 6 months to renew their benefits. So those are things that we have to take back and into consideration, and it's something that I would definitely take back with our executive team as we continue to meet.
Thank you for that as well, Ms. Palmer. Wanted to just respond to a couple of questions that have similar themes in regards to, what are the choices or what are the next steps that our state legislators will need to take as it relates to how this legislation will be implemented in North Carolina. I think, as Ms. Palmer mentioned, there's still a lot that's up in the air. There's a budget that needs to be finalized and passed, and that's still in the works. So if you have insights or thoughts that you want to contribute, I certainly encourage you all reach out to your legislators again on the federal and state level in regards to what's happening here, but particularly to our General Assembly members as it relates to North Carolina. See another question here in regards to Medicare prescription drug changes for Part D. Are there any insights in regards to that?
Maybe I'll start on that one. So the legislation did not have a lot of very specific pieces specifically on Medicare Part D. There are, for folks who are currently on Medicare and receiving care through one of their standalone prescription drug plans or Part D plans, there have been some issues, and you may have seen this recently in terms of premiums and stability of those plans. Those are in some ways independent of the One Big Beautiful Bill, although, in health policy, things are very connected to each other. So there is probably not major changes to the Part D market in terms of how the One Big Beautiful Bill specifically had pieces in there. There were some pieces in there about, prescription drug negotiation and defining what is an orphan drug or specific types of drugs that could be negotiated. But big picture on the Part D side, there was less. But Laquana, anything that you would add or subtract to that?
I actually met with our partners in the Division of Families and Opportunities, and checked in with them to see whether or not there was additional things that we need to pull out from Medicare. And it is exactly what you just shared. But they also stated that the biggest focus right now was SNAP and Medicaid, because those were the areas that we saw the biggest changes in Health and Human Services at this time.
Thank you. That's really helpful. I have one final question that I'd like to present to you all, and it's in regards to dual enrollment. So, what are the potential impacts of a person who is dually enrolled in Medicaid, including waiver for home community-based services and Medicare? Are there any tools to simulate how these new laws will affect people who are enrolled in different benefit programs, and how those effects could ultimately affect others in our economy?
Do you want to go first? You want me to?
Sure, I'll go first. So there's a number of things, and there was also a question in the chat on what are some of the things that we need in place to ensure that those who are dually, enrolled, whether it is, Medicaid or Medicare or enrolled in both. There's some things that we have in place right now with the General Assembly that must happen in order to ensure that we do not see any disruptions in services. One, they must fund our full rebase. That means our full budget for Medicaid. Our full budget right now is 819, yes, $819 million. They have to fund that fully in order to ensure we don't see any disruptions at all. But then also we want to make sure that they fund the increase in administrative costs for work requirements by either enacting technical corrections to these hospital provider taxes that Dr. Saunders just spoke to, also modifying the trigger law to ensure that we don't lose any state funds, to ensure that we can keep Medicaid expansion going. And then we also want to make sure that we have Medicaid oversight fund in place, and want to make sure that we fund healthy opportunities as well. So, in order to make sure that we don't have any disruptions at all, the number one on the list is making sure that we have a budget, a full budget. If we don't have a full budget, we cannot guarantee that we won't see changes in our different services.
And maybe I'll add to that some other pieces in the legislation that are of relevance to folks who are duly eligible for Medicare and Medicaid, which oftentimes are older adults who have lower incomes, although there are other people who are eligible for Medicare and Medicaid as well, but that's the largest group. There are some administrative changes. There were some changes in the last administration that were proposed to help streamline access to certain types of programs that could help with cost sharing or the like for folks who are in those categories. And the legislation paused some of that work. And so there will be some administrative requirements that folks will need to navigate as they are trying to work between those two systems. The question specifically asked about home and community-based services. This is a tension here that many people don't realize about Medicaid. So because Medicaid was started 60 years ago, a lot of the pieces of the Medicaid program reflect how we may have thought about healthcare 60 years ago. And Medicaid requires that states cover nursing home care, but they don't necessarily require that states cover care in the community or care in the home. Now, I think we know that many people would prefer to stay in their home and age and place and stay in their community. And that also is oftentimes better for budgets as well, because that tends to be cheaper care than nursing home care. So one of the tensions that has come up is whether states will have the resources to keep offering those home and community-based services. And as Laquana mentioned, that's a question that states are going to have to grapple with during implementation, and there's not an answer right now. States are having to think through their budgets, and they may have to make hard trade-offs, and that may be one of those hard trade-offs that states are going to have to think through. There are some provisions in the legislation for some specific types of waivers or ability that states can experiment in home and community-based services. We still don't know all the details and what that might look like. And so I think states are interested in understanding what that may be. I think there's still questions about who can take advantage of it and whether they can do that. States will have a lot on their plate with just implementation of all of the new work requirement administration and the IT changes and all of that administration. And so it may be challenging for states to take on another initiative on top of that. But those are some of the changes in the legislation that I've seen that are specific to people who are duly eligible for Medicare and Medicaid, and especially people who benefit and use home and community-based services.
Thank you so much for that informative answer. I certainly want to just take this time to thank all of our presenters on today, Ms. Palmer, Dr. Saunders, Ms. Watson. This was certainly informative, and it's still so much for us to learn. And so I certainly hope that with time, as things evolve, both in the federal and state level, that we can hopefully have a follow-up at a later date so that we can continue to keep our constituents in the 4th District informed. Again, we're so grateful for all of our attendees that were here on today. We will plan to share the recording and also follow up on any unanswered questions that were submitted. So if we have stats that we're able to share, we will certainly make sure that we get that disseminated to all of our registrants. So with that, I thank you all for taking time during your lunch today to learn more about Medicaid and Medicare and the implications of the One Big Beautiful Bill on our state's healthcare system. So with that, thank you all. Have a wonderful afternoon and look forward to hearing from you all soon. Take care. Bye-bye.